My name is Jacqueline Towernicki. I'm a nurse practitioner at a federally qualified health center here in Missoula, and I love to treat people with substance use disorders. I feel it's super rewarding and quite a privilege as a provider to be a part of something so big in their life. And I hope at some point you will get to meet with some of my patients and really see what treating addiction is like for them, because we are not our disease, right? Like, people who have cancer are not cancer. People who have, there's so much more than that. So folks who have battled with addiction, they are so much more than that.
So I was 25 when I was diagnosed with muscular dystrophy, and instantly I was put on 180 pain pills a month. And it just kind of progressed from there. Soon those weren't working. I built up a tolerance, so I was taking stronger things, and then I was running out of my prescriptions early, and it just kept getting worse and worse.
Every day seeking something to become miserable, 24 hours later. Every single day. Doing whatever you have to do, and it be theft or hustling or whatever. It doesn't matter who gets disrespected as long as you're respecting your addiction and feeding it. I mean, it's miserable. It's pure misery. And it's a vicious cycle that goes nowhere.
Where I've seen my patients have difficulties is the expectations by others might not be as understanding, because a lot of patients end up being turned away if they have a slip or if they return to use, and that's really unfair. It's a disease that needs to be managed well. So if we turn our back on them in some of their most vulnerable times, it's only going to push them further into a potential full-blown, relapse.
I had a really hard time staying sober. I have quite a bit of pain, and so even if I could make it a week or a month or whatever, eventually I would relapse because I couldn't handle it anymore. And talking to the doctors here really helped me. I didn't realize that I could take Suboxone and that it would treat my pain, but it does. It's awesome.
This time I was being released from prison for the third time in my life. I've been through every treatment program the DOC has to offer. I'm sick of overdosing and dying and leaving it up to chance. There's no chance. I'm an addict. I know that. That's one thing I know for sure, and I knew that that was a good opportunity to be successful and have the opportunity at life.
The IMAT program, I've done a couple different programs, and there's nothing like the IMAT program. You have support, a support network that is so caring and loving and willing, and they don't judge you. They don't, yes, they hold you accountable. You can't just use drugs in their program, but not once have I ever been shamed in their program. Not once have I ever not had someone to call, from scheduling to the doctor's team. IMAT program itself is a tool of success, and that's the truth. It's a fact.
So the IMAT program has relieved a lot of stress. I've known Adam for a very long time before we got married and before we started dating, and we've both been in and out of our cycles, and but I got very close to him this last time when we started dating, and just seeing him try to do it on his own is very painful. It was very hopeless. The medication, when he first actually told me he was getting on Suboxone, I was a hater. I was like, that's the easy way out, because I didn't understand opioid addiction. I had been through several addictions of my own, but never opioids. And, you know, I look back and I'm glad that he found what worked for him and that I was able to meet him where he was at, because it's what he needed. And I've never understood like the true physical needs that you create when you use some of these things, and what your body really needs to move on from that and to not use those things anymore.
When I see people make such important strides in their life and be able to bear witness to that, it's just a privilege. It is so rewarding. Even though some of those things are heavy, the positive aspects are so fulfilling as a medical provider. It's the best way to fight burnout. I feel very effective, and I love every one of them.
From the beginning, I was treated like I had an illness, and that's the first time that's ever happened to me. So that made me feel really comfortable opening up to my doctors. Initially, there was a lot of treatment classes and a lot of appointments, but as I was in the program longer, that changed to where I see the doctor every 2 months now and get my prescriptions.
I follow a schedule for the first time in my life. I have balance. I actually can look at my life as different aspects, social, you know, physical, mental, whatever, and pay attention to everything. And my main focus ain't just this addiction. I know I'm an addict, but it's not my every thought every day now. I do what I have to do to function outside of my addiction.
For so many years, I was treated like I was less than, looked down upon because of my drug use, and I don't know. I'd like to see things change even more. It's been amazing here in Missoula, the way that my doctors have treated me, but I've never had that experience before. And being treated like you're less than, or you're doing something wrong, or you're making this immoral choice by using drugs, just makes you want to use more. You just feel horrible. And so having even one doctor that supported me and treated me like a person made all the difference.
Turning all of this around starts with the medical community. I feel like every single one of my colleagues and every medical provider out there needs to hear this message and needs to open their eyes and be more accepting, and think about addiction as a disease and treat it as such. That's where it starts.